Your patient's heart rate is dangerously low. What medication are you grabbing? Hey everybody, my name is Hannah. I'm a full-time paramedic and welcome back to Let's Talk Drugs. As always, this is just educational. This is not medical advice. I actually got a request from somebody to cover atropine, so that's what we're discussing today. Atropine belongs to the drug class of an anticholinergic. So atropine is going to be what we give somebody whose heart rate is dangerously low. This is called bradycardia. Clinical definition is going to be anything less than 60 beats per minute. So let's break this down. Your heart rate is controlled by two main systems. It's going to be controlled by the sympathetic and the parasympathetic nervous systems. The sympathetic nervous system is going to be responsible for fight or flight. It's going to be speeding things up. The parasympathetic nervous system slows things down. The parasympathetic system also works through something called the vagus nerve. And this nerve can be activated for many different reasons. However, when it is stimulated, it's going to release a chemical called acetylcholine. And acetylcholine is responsible for telling the heart, hey, let's calm down. So acetylcholine binds to muscarinic receptors in our body. And you can think of these receptors like tiny little boat loading docks. Acetylcholine is going to dock in this receptor and then tell the heart to slow down. So when atropine is introduced, it's basically going to compete for this tiny boating dock, for this receptor, and beat acetylcholine to this dock and dock first. Meaning that acetylcholine now has nowhere to dock. And no docking means no slowdown signal is being released. So now that the slowdown signal has been stopped, the heart rate can rise again. I do want to quickly mention that atropine is not going to work for all slow type rhythms. Also need to be aware of stable versus unstable bradycardia, whether you use medication or electricity first. Atropine can also actually be used for organophosphate poisoning. I'm not going to cover that in this video, but I can totally do another video on that if you're interested.